Hi, and welcome to the Clinician Spotlight. My name is Tony Maritato. I'm a licensed physical therapist, and joining me today is Cindy Weinberger. Now, Cindy is an occupational therapist and a certified hand therapist herself, but she's also the owner of Mobile Therapy Group. Mobile Therapy Group is a provider of both physical and occupational therapy services. They specialize in hand therapy services delivered in the patient's home or in a clinic. So I'm going to have Cindy come on and join me, and let's learn more about her business. All right, so welcome, Cindy. Thank you so much for joining me today. The first thing I'd love to hear about is what got you interested in becoming an occupational therapist in the first place? And more specifically, how did you choose to go down the road of hand therapy?
Well, I've been an occupational therapist for a very long time. I'm not sure I should tell you how many years, but a very long time. It was just, I always wanted to get into a career of helping people. I didn't know when I was a wee one in high school exactly what that was going to look like. Believe it or not, I volunteered at the hospital when I was like 15 years old, and I explored physical therapy. I learned what occupational therapy even was, just kind of trying to decide where I fit, and ended up choosing OT. And I went straight from high school into an OT program and have been an OT for 30 some odd years. So, throughout my career, seen so many different patients in so many different areas, hospitals and nursing homes and in-home and outpatient. I mean, pretty much every area that you can see patients in, I've seen them. And I just started really to develop a love for hand therapy. I wanted to be specialist in something. I really feel like hand therapy, there's not one person out there that doesn't value their hands. It doesn't matter if you're a neurosurgeon, a mom, a housekeeper, or a physical therapist. If you don't have good use of your hands, you are in trouble. Like, you really, really need them. And I wanted to really work with people on something that they valued.
I agree. I think it's
Everybody.
one of those things you don't realize it until it's gone. And then all of a sudden you realize how important it is and how it influences just every part of your life. Now, your business is so unique and interesting. You guys are offering occupational therapy, physical therapy, and hand therapy, but you're doing it both in the patient's home and in the clinic. In fact, you're in the clinic right now. Can you tell us a little bit about your business, the area that you serve, and how you kind of got into being a business owner, not just a therapist?
Yeah, absolutely. So I live in South Florida. I'm in West Palm Beach, Florida, and I moved here only almost 4 years ago. And when I moved here, I was working for a clinic, and I felt very tied, so to speak,
Yeah.
by the way clinics are run, particularly in South Florida. Very often you're expected to see multiple patients simultaneously. I remember sitting with 3 patients around a table, and me trying to give each of 3 patients really good quality care. By bopping from one to the other. I remember coming home and telling my husband, I feel like a bartender serving up exercises. I mean, that's kind of what it would feel like by the end of the day. Like, and that really wasn't why I got into therapy. That wasn't the vision for me. I wanted an opportunity to really spend time with my patients. That's what I enjoy, one-on-one. And this was at the very beginning of COVID. And there was a real need for in-home because people were so afraid to go into the clinic setting, didn't want to go into the clinic setting. And so the fact that I was laid off from my job due to COVID, okay, so that really opened up the opportunity to do this full time. And so I was sad for a few hours, and then I was like, woohoo, this is my opportunity. I'm going to do this. And so I kind of jumped in fully, and it's been a huge success and benefit to people because they like having a therapist come to their house and not have to travel. So it started out purely mobile, purely OT hand therapy. very quickly realized I needed physical therapy as part of my team. So I hired a few physical therapists. And then I really started feeling like I personally, for my own life goals, didn't want to be traveling so much. I wanted to kind of stay put. So decided to open up a clinic space. So I'm pretty much in the clinic full-time myself, treating upper extremity patients, including like custom splinting we can do through Medicare, which is awesome. And then I have a team of 8 therapists right now that are on the road, covering Palm Beach County. So pretty much covering from like even more than Palm Beach County, like Jupiter, and even up to Port St. Lucie, which is pretty far north in this area, down south, some patients as south as Fort Lauderdale. But the majority of my patients are Palm Beach County.
Wow. And I
Physical
came
therapy.
I came from Sarasota, Florida, so I'm very familiar with the area.
Yeah, the
Something
other
that you
coast.
mentioned Medicare. So one of the things that I think is confusing for a lot of consumers and even physicians is the difference between Medicare Part A covered services for home health therapy and what you're doing as a Medicare Part B provider in outpatient therapy. So could you explain the difference between the two?
Yes, I explain it about 100 times a day. So Medicare Part A is hospitalization, inpatient hospitalization, and it also covers that immediate period when you come home from the hospital and you are homebound. Very difficult to get out. It covers for a short period of time. And during that period that you're receiving Medicare A homebound services, you cannot also be receiving benefits from Medicare B. Medicare B is outpatient therapy. So the services, when you go into a clinic setting, that's Medicare B. So I always try very carefully to tell people that we are not home care providers. We go to the home, but we are outpatient therapists that come to your home. I feel like that explains it a little bit better. And I'm often have to explain it even to the doctors and referring providers because people, really don't entirely understand that.
It's true. I think you
So
explained that beautifully. So I want to be mindful of your time. For everybody that's watching this in your area, what would be the best way for them to contact you, to reach out to you if they have questions or they have a referral for therapy and they'd like to get started?
So I have a website is www.mobiletherapygroup.com. My email is Cindy, CINDY, at mobiletherapygroup.com. Phone numbers 561-461-5343, and that can be a text or a call. And the exciting news is I just hired a new physical therapist who has a TPI certification for golfing. So that's pretty awesome. So I'm kind of delving into some specialty areas. I have another physical therapist that's an oncology specialist, another one who does dry needling. So we're starting, and Parkinson's, another one that has the LSBT. So we're starting to really branch off into some nice specialty areas on top of the hand therapy too. So it's pretty
I
cool.
can imagine the combination of a therapist doing the hand therapy to improve grip strength and control of the club, and then the TPI certified therapist to improve performance on the course. That's awesome. Cindy,
Yeah.
stay right where you are. Thank you so much for coming on to the show. Guys, if you want therapy, whether it be occupational therapy, physical therapy, specialized hand therapy, if you need it in the home because you can't get out to a clinic or you want to go visit Cindy in the clinic, I'll put all of her contact information that she shared down in the description of this video. One more time, Cindy, thank you so much for being on, and I'll talk to you soon.
Thanks for having me, Tony. This was a lot of fun. I enjoyed talking to you. Thanks.